My name is Maneet and I am a third-year medical student at St. George's University School of Medicine. I thought I would make a video just going over how the rotation was structured, my day-to-day schedule, how I studied, and just anything else that I think is important for you to know before starting the rotation. So with that being said, let's get started. So family med is 6 weeks long. So for me, with the preceptor that I had, it had a bit of a later start. So I would use my mornings to study before I went in to the clinic, because I knew once I was at the clinic, it would be harder for me to study afterwards because it was later, I would be tired. So that's just kind of how I managed my studying alongside going into the clinic. Once we were at clinic, this preceptor allowed us a lot of autonomy. So once we were there, we were seeing a lot of patients by ourselves. We'd get the approval from the doctor to do the procedure. So once we went in and saw a patient, we would always get approval from the doctor and what we thought was the best next steps, like what tests did this patient need, labs that the patient needed to get, was there any imaging, was there anything in office that we could provide them that would be helpful. So this was a lot of the time things like B12 shots, steroid shots, maybe doing a spirometry, maybe a wound dressing, maybe some sort of screening. And the doctor, once we had seen a lot of this, was allowing us to do them by ourselves once she felt comfortable in our skills. And I think that was so great, and honestly really allowed me to grow, learn the skills that I will be using down the road. And also with patients that the doctor knew were coming in frequently, she allowed us to see them. So for instance, she would assign each student one or two patients that she knew came in frequently, so that we could develop the therapeutic alliance and relationship with them and just see them through their care and see how we were best able to help them. And I really appreciated that. And her schedule was Monday to Friday, and it was usually 8-hour shifts depending on when we started. So in terms of studying, there's a lot of parallels between studying for family med and previous rotations, but there are a few things that I did implement because they were things that were different for family medicine. So in terms of AMBOSS was the same. So for AMBOSS, SGU will assign you quizzes every week. So I would do these on the weekends and review them on the weekend. For UWorld, I did both the family medicine and the ambulatory deck. So it was a lot of questions for the 6 weeks, but I found that this allowed me to be the best prepared for my exam. So I did both the family medicine and the ambulatory deck. And so again, before I started the rotation, I divided them up to be done by about week 3 or 4. And I would do these questions before I went into work. And obviously on my days off, I was doing more questions than during days with work. And I would do the question and then have my Google Doc on which I made my own notes. So I made sure to color coordinate and organize them because that's how I learned the best. So I would have the subheading in one color, and then things related to so like risk factors, symptoms, diagnostic criteria, imaging, labs, treatment in different colors. And I made sure that the colors I was using were the same for each rotation. So for instance, risk factors would be the same for every single rotation. So my brain got used to seeing green because that's the color I use as risk factors, and that just kind of helped me learn and just helped me keep everything clear in my mind. And so again, I was done with I want to say about week 4, and then my last 2 weeks I just did incorrects, which meant going and reading my notes and memorizing and understanding the topics in my notes, then doing the incorrects. And so this is what I did for pass 2 and pass 3. And pass 4, like my other rotations, I would do the Melmin document with the high yield bullet point. And then Anki, again, I divided it at the start of the rotation to make sure that by week 4 I would be done all the new cards, that the last 2 weeks would just be doing reviews and solidifying that knowledge and content. NBME exams I did during my the last week and a half of the rotation. And again, the way I reviewed the NBME exams was the exact same way that I reviewed the UWorld, but I made sure to know the topics and how they were asking the topics, because that is very important, I find, to being successful on these exams, is how are they asking you the topics, how are they wording things, how are they displaying the information of certain topics, what details are they focusing on, because those things I find are important to be able to notice and pick out when you are doing your final exam. And then during my last couple of days before my exam, I also watched the Dr. High Yield video for family medicine, just to go over the topics that will be tested on the family medicine exam. So the things that I mentioned so far are pretty standard for every rotation. For family medicine, there are also things that you must know outside of your world. So for instance, I would make sure you know the USTSP guidelines. So know them for different special populations. For the general population, make sure you know the age cutoffs. Make sure you know if there's anything different between men and women, because this is how they will try to trip you up on the exam. So make sure you know these guidelines inside and out. There is a very, very good video by Dr. High Guru that I found was great, and he also has a PDF which you can annotate, and it has everything listed out very nicely in a timeline format. So make sure you know the USTSP guidelines inside and out, because there will be quite a few questions on your exam from this. Also, make sure you know your vaccine schedules, because this is just something that was on the exam. So know the pediatric ones, know the adult vaccines, just know these because these are easy points on the exam. And also screening. So this ties into the guidelines, but know at what age, for what age group are you screening for what. It's when do you screen for high blood pressure? When are you screening for diabetes? When are you screening for osteoporosis? Which population? So make sure you know these things. Make sure you know all of the guidelines, all of the screenings, because they're such easy points, but it's whether you know it or not. So make sure you go over them before you go into your exam. So just some things that I think are very high yield for the exam. So make sure you know the topic of hypertension inside and out, dyslipidemia inside and out, asthma, COPD, chronic kidney disease, obesity. Know the different guidelines, know treatment, know if there's any age cutoffs, if there's any value cutoffs, know, because this is how the NBME will try to trip you up. So know all those little details, because I think that that's very important. And just some test taking tips to know are very helpful. If you're unsure about something, pick the most guideline forward or most preventative focused answer. Always consider the age and risk factor when answering questions. So always make sure you take a look at the age and any risk factors that the patient has, because this can oftentimes help you eliminate answer choices. And also be very focused on first line for medication for different conditions, because always focus on first line treatment, because a lot of the times in family medicine you don't want to go to the most severe one, but our brains sometimes, based on which rotations you've had previous, will focus on those. So make sure you focus on the most non-invasive treatment, and make sure you know the order. So let's say this non-invasive treatment doesn't work, then what would you give next? Then what would you give? Make sure you know that order, because a lot of the times they'll give you a patient where they've tried treatment option A, they've tried treatment option B, but none of those have worked. So what do you do next? And a lot of times they'll list every single one for that pathology there. So if you don't know that order, it can get harder to eliminate. Oh, and also another thing to just be mindful of when studying is focus on MSK, because on some family medicine exams, MSK is very high yield, and on some it's not. So I would make sure to go over MSK and have a pretty good grasp on the different conditions, because some exams focus very heavily on MSK. And then in terms of evaluation, so how are you going to be evaluated? One of the exams that you have that makes up some part of your overall grade is your mid-course. So other previous rotations, I would focus on the AMBOSS schedule. So you can use UWorld, but make sure you're covering the content that they've covered in AMBOSS up to the date of your mid-core. And again, it's done at home, it's on Exemplify on your laptop. It's 110 questions, you have 2 hours and 45 minutes. And you have your shelf exam. Your shelf exam makes up a huge chunk of your overall grade, and this is done at the very end of your rotation. SGU will give you your permit. They will email you your permit, and once you have your permit, you're able to schedule it at whichever Prometric Center you would like. They're done at Prometric Center, and again, they're 2 hours 45 minutes long and 110 questions. And then you'll have 2 SOAP notes that are required. You'll have patient encounter logs. You'll have a few modules and a few evaluations that you need to complete. But again, I would just refer to your syllabus on Sakai, because they're constantly changing the requirements, constantly changing how many of each you need to do. And you just don't want to lose these easy points that could possibly affect your grade at the end. So with that being said, that's kind of everything that I have for family medicine. And I hope that this video was helpful and provides some insight and some structure and just some information on how family medicine is structured and what to expect. And like like always, if you have any questions or something was unclear, you can always reach out. Always more than happy to help. Just remember, you got this. You're so capable, you're so intelligent, and you're going to make a great physician. Bye.